So two things from the last lecture. One is that as veterinarians, you're asked a lot of questions about these cases, and it's not uncommon for you to be asked questions that should be addressed to an attorney. You will be asked lots of legal questions, and the best answer is you need to speak to the prosecutor or something like that. You should not be answering questions where it's clearly significant to the case and it requires legal expertise. And then the other thing is that I just didn't get to one slide that I wanted to show you. I did a study with Dr. Jody Gurdon, who I gave a shout out to earlier. Jody did the retrospective review of, she's a pathologist, of emaciated deceased animals that came through our place and some other places. We send all of our histopath tissues to Cornell. And the statistically significant finding in that was that if an animal has an underlying medical problem, a disease process, and it's become emaciated as a result, their stomach's probably going to be empty if you're doing a necropsy, because they're not eating because of their disease process. Whereas if they're being starved, if they're just not being provided with adequate food, they will eat anything, and so you'll find all kinds of stuff in the stomach. You might find significant ulceration in the stomach. It does not prevent them from eating. So that was found to be statistically significant in that retrospective study and is important if you're doing a necropsy on an emaciated animal. Okay, so this one is about non-accidental injury. And these are the types of medical problems or causes of injury. Blunt force trauma is far and away the most common, and that's what I'm going to spend the most time discussing. We do see sharp force trauma, the difference between a blunt object, whether it's something that hits the animal, could be, a weapon that's blunt, it could be a foot, a hand, could be the animal being thrown. Those are all blunt force impact injuries that result. Sharp force trauma is from a sharp object. Gunshots, we see some gunshots. I think that talking to people, and there's a pathologist at Penn State, they see a lot of gunshots in more rural environments than we see in New York City. So we see a handful each year, but outside of the city, just much more common is what it is. Animal fighting would have to be considered non-accidental injury. The animals are being forced into that situation. You can see wounds, binding linear wounds. People bind their muzzles shut, leave a scar, maybe significant injury, burns, drowning, poisoning, but far and away the most common thing, at least that we're seeing in New York City, are blunt force trauma injuries. Basic questions a veterinarian has to answer for each case that they see. Number one, is the animal injured or has its health been impaired? Number two, is the animal in pain? You have to do a pain assessment of some sort because you may have to testify to that. The question may be, was the animal in pain? What were your observations? What behavior did the animal express that showed you that it was in pain? So it's very important when you do that intake exam, if you're seeing behavior you think is consistent with pain, to document it. It would not be uncommon in regular practice for an animal to be hit by a car. You see the treatment includes a fentanyl CRI, and there's actually nothing written about pain. It's just assumed the animal's injured and it's in pain. That doesn't work for these cases because you may have to either write a statement that says that the animal was in pain and why your interpretation of their behavior, or you may have to testify to that. Then also, has the animal been permanently injured? That increases the severity of the problem and is important to prosecution. So Tweety was a 6-month-old cat who was physically abused. and one it had multiple injuries, but one of the results of the abuse was that she lost her right eye. So very significant in the criminal prosecution. And that's because that's the kind of question that is asked based on the law as it's written. And then I mentioned already definitive diagnosis is necessary for a prosecution. Other questions that are important to try to answer: duration. How long did the animal have the problem? There are ways to try to determine that. For instance, as far as bone fractures, you'll see evidence of healing, and I'll show you radiographs, for instance, that show that. And then in cases where there's a severe wound, you may be able to make an estimate of the age of the wound. Brutus was a 10-year-old German Shepherd dog with, an embedded collar. It turned out to be a chain. Okay, and we had to put Brutus under general anesthesia to remove the chain surgically, but then we do a biopsy perpendicular to that circumferential wound from the haired skin through all the scar tissue that's accumulated over time down to healthy tissue, submit that for histopathology, and they will make an estimate of, based on the accumulation of scar tissue, really sort of the basic information is that it accumulates about 1 centimeter a month. So if you measure that scar tissue, you can get an approximation of the age of the wound. So in Brutus's case, the estimation was that that chain had to be embedded for a minimum of 3 months, which is valuable information in a criminal prosecution. The term repetitive trauma is in that Monroe book. Spike was a battered puppy, using the term that was originally written about in Dr. Kemp's article in 1962 in the Journal of the American Medical Association about the battered child syndrome, and then Dr. Helen Monroe took that, as Dr. Lockwood mentioned last night, and used it to describe animals that were experiencing repeated trauma. So the word repetitive trauma is also used. But Spike was born on March 11, 2009, and the first veterinary visit was when Spike was 3 months old, and then there were 12 veterinary visits between the age of 3 months and 11 months over an 8-month period, all associated with traumatic events. Fracture of all the bones that go to make up the right elbow, left hind femoral neck fracture, bilateral oral hematomas, right corneal pathology, and then 3 maxillary tooth fractures. Something that you can do to assist the prosecution is to create a timeline. And you do that, it may be just a record review. It may not be that you saw the animal between that 3 and 11-month period. I didn't see Spike during that period. He was going to another animal hospital in New York City. It didn't occur to them that this is a problem, that this young dog keeps showing up. That's a different issue. But then I got the opportunity to look at those medical records. And so I was able to create a timeline which is very valuable for the prosecution. So right oral hematoma when he was 3 months old. At 4 months, the right elbow fracture. At 5 months, the left oral hematoma. At 8 months, left femoral neck fracture. He'd been lame for a couple of weeks before he showed up at the veterinary hospital. And then 11 months down the road, severe right corneal ulcer that covered 3/4 of the corneal surface. There was no indication of when those tooth fractures occurred. So the radiograph showing pretty much the complete destruction of that right elbow, and all those findings are from a radiologist. We submit radiographs on a regular basis to radiologists to give us very exact description of the findings. There is now a radiologist who lives and works in the Florida Keys. That's nice, right? But you can send everything electronically. It's Dr. Liz Watson, and she is a forensic veterinary radiologist and writes remarkable reports and understands that we're going to, if she doesn't answer the question, how old do you think that fracture is? Or we see fractures that seem to be at different stages of healing. Can you age them? And she answers that without asking the question. She'll talk about duration and all kinds of things like that. So great reports. Left femoral neck fracture, a femoral head osteotomy was done. There were additional injuries to the left hind stifle. So the way this came to light, I said that this dog made 12 visits to veterinary hospitals during an 8-month period from 3 months to 11 months of age. There was no report to law enforcement from those visits. But a teenager knew that something was going on in the house, had his cell phone. In New York City, you have one street, another street, a row of houses, and then they have adjoining backyards. So he sat on his porch, looked across the way, and he made this video of what he was watching. So at that point, he stopped video recording, started screaming at the woman, posted the video on YouTube, and then contacted the police. And so now the police have evidence. It's if the tree falls in the forest, does it make a sound? Well, just because, that video may not exist doesn't mean you can't look at that series of injuries and say there's something wrong. There's too much trauma here. It's a young dog. It turns out that there was a husband, a wife, and a 12-year-old son, and it was the wife who was actually the abuser. So once law enforcement got that video and they were not aware of all the medical records, they went around to question her, and she was arrested. She denied everything, and then they showed her the video. And then we got Spike, and I was able to create that timeline. Like I said, I could identify the injuries when he finally got to us, but I didn't have all of that really detailed information other than from the medical records. And then he got a new home. There are different reasons to suspect animal abuse when an animal is injured. So that's as a veterinarian being the complainant, meaning the animal comes into you. It may be something as simple as the person confesses, and then you have to realize that, the fact that they're confessing doesn't preclude you now calling law enforcement and say, yeah, the person said he threw the dog against the wall and its leg is broken as a result. Just realize that if you don't make that call, that animal is going back into that same violent household. There may be other animals and there may be people, and it's very possible that there are going to be multiple victims. So I know it's a difficult thing to make that phone call, but you may, it's enough to rescue that animal from that situation, but you may be rescuing many other animals and or people. Or the person may actually, say they know who did it. It may be the behavior of the person arouses suspicion, may be reluctant to explain the animal's injuries, may become defensive or angry when questioned. Person has a lack of concern for the animal. This isn't the only thing that you're going to go on to make a complaint. It's also, you functioning as a veterinarian and identifying the injuries and saying there's a problem here. You may have injuries at different stages of healing, and you'll see cases like that today. May be that the history is discrepant. More than one explanation for the injury or injuries is given by one individual, or multiple people give different explanation as to the cause of the animal's injuries. The person may call on the phone, give an explanation as to what happened to the receptionist, show up, give a different explanation when they're actually in person, give another explanation to the nurse, maybe a different one to the doctor. That happens. People are not necessarily consistent, and they're not necessarily thinking that anybody is going to actually see what's happening. The review of the medical records is very important, and that's standard veterinary medicine. An animal comes into you, and you have previous medical records from that animal or other animals in the family. Look at them, even just not because you're looking for animal abuse, because you want to know, is there any previous information that will help me diagnose the animal's health problems? The animal doesn't go outdoors, is not exposed to unknown causes of trauma, but comes in with severe traumatic injuries. There is no history of accidental trauma like a motor vehicle accident. Or it may be that the animal's caught in the larger problem of family violence. In some states, not New York, veterinarians are mandated reporters for child abuse. Families come in, you may see something happening in the family situation that actually is important for you to report. It may be not about the animal, maybe it's about what's going on with the people. Animal cruelty and child abuse there are connections, triggers that put animals and children at risk are similar with a violent individual in a household, the need for constant supervision, elimination accidents in the house. It's a major reason people give animals up at shelters, chronic illnesses that require long-term care or result in a significant financial burden, destructive or aggressive and noisy behavior, or again caught in the larger problem of family violence. So this list is from one of the texts Dr. Lockwood showed you last night. Child abuse, domestic violence, and animal abuse, linking the circles of compassion for prevention and intervention. What are the clinical signs you might see that would make you suspect that this might be animal abuse? It may be that the injuries identified are simply not explained by the account of the event. It may be that there are repetitive injuries. It may be that the injury type varies with each episode but features fractures or severe trauma prominently. And it may be that the pattern and type of injuries is consistent with a non-accidental event and not an accident. So this is from a human forensic pathologist. Blunt force trauma due to falls to the ground or similar benign circumstances should be distributed over bony prominence of the body and have a pattern of injuries along one plane of impact of the body. Seeing injuries on both sides of the body is problematic for a basic fall. Injuries to recessed areas or protected parts of the body are suspicious for assault. So we've seen a number of animals over the years that have been kicked in the abdomen and end up with a ruptured bladder, and there's a single contusion on the abdomen. Hard to explain that accidentally. So a study between the Tufts and the ASPCA, I want to spend a little time on this. This is now starting to look at, what are the pattern and type of injuries for motor vehicle accidents. That was from over 400 cases at Tufts Veterinary School, and then those were 50 cases that we had at the ASPCA, animal abuse. And you can see a very different pattern of injuries. So lung injuries are really common in motor vehicle accidents. Pneumothorax, almost 30% compared to just 6% in animal abuse cases. Pulmonary contusion, twice as many in motor vehicle accidents. The most commonly fractured bone in a motor vehicle accident is the pelvis. Okay, and in multiple studies, about 1 out of 5, really commonly, and this study came up with 22.5%. They do exist in physical abuse cases. So if you have a pelvic fracture, it doesn't mean that the animal wasn't abused, but you may see a particular pattern of skin injuries, pelvic fractures, and say, this looks exactly like a motor vehicle accident. Degloving injuries, abrasions. Then look at non-accidental injuries, scleral hemorrhage in almost a third of the animals. The head is a target in abuse cases, whether it's a person or an animal that's the victim. You know, the head is an obvious target even in nature. You take social groups of primates like chimpanzees and gorillas, and they've done studies, and there are a lot of head injuries in those groups when there's intergroup fighting. Skull fractures, almost a third of our cases. Very common. I'm going to show you some of those cases. Spinous processes of the vertebrae, 3 times as many in motor vehicle accidents. Look at ribs, 28% versus 8.9%. That 8.9% is relatively high from compared to some of the other motor vehicle accident studies. There was a big study done at UPenn in the 70s. They had 600 motor vehicle accidents. The incidence of rib fractures was 3%, 3 out of 100. Not common in motor vehicle accidents, but very common, and you'll see in physical abuse cases, and not just that there's a single rib fracture, but that there are multiple rib fractures that can only be explained by multiple impacts. Think about it, a motor vehicle hits the animal once, and then maybe there's a secondary impact when the animal hits the ground, but that's it. Physical abuse cases, if you can identify that there's no way you could get all of those injuries from a single major impact and a secondary impact, then you have to think about abuse. And then in the bottom right, older fractures, that's that repetitive trauma. In a fifth of the cases where it's less than 1% in motor vehicle accidents that were seen at Tufts. So this is a dog that was hit by a car. They've got those real focal injuries to the skin where it's a full thickness defect, and then if you can see it, friction abrasion or road rash on that whole inguinal area. And that's the kind of thing you expect to see with a motor vehicle accident. Here's another dog, very similar presentation with multiple focal injuries, abrasions, and full thickness skin injuries. And that dog also had a pelvic fracture. So you're looking for a certain pattern and type of injuries that, yes, that looks like a motor vehicle accident. So here's a case. Woman gives her boyfriend a 5-month-old dachshund as a present. He calls her early in the evening. The dog is not right. She says bring it to the veterinary hospital, calls back a few hours later, has not brought the dog in, so she convinces him to take the dog over. His explanation for the dog's injuries is that it fell while it was being bathed. The dog had a hemothorax, a hemoabdomen, liver lacerations, fractures of left ribs 10, 11, and 12, which there were 2 fractures of rib 11, and then right ribs 3, 4, 5, and 6. And the puppy died 20 hours subsequent to admission to the hospital. The injuries could not have possibly happened as a result of the description of the event. The radiograph showing the rib fractures. 2 separate impacts would be necessary for those. They're on both sides of the body. It has to raise the suspicion for a physical abuse case. It's hard to break puppy ribs. You know, they're relatively elastic. It's like trying to break a sapling over your knee. It's easier to break a woody tree branch. So looking at the pattern, which is 2 sides of the body, the fact that it's a puppy, this is pretty classic for physical abuse cases. During the investigation, it was found out that she had given him a puppy a number of months earlier, and that one died as well. That was exhumed and was shown to have a skull fracture. So this did go to trial. He was found guilty of both aggravated cruelty to animals, that's the young puppy that died, that he brought to the emergency hospital, because we could not say too much more other than that there was a skull fracture because the dog had been buried for a number of months. He was found guilty of misdemeanor animal cruelty for that one. And then that's his sentence below. Again, pattern of injury is really important. You know, it's the same thing doesn't happen to an animal when it's hit by a car as a motor vehicle accident or a high-rise fall, for instance. So we work frequently with the Animal Medical Center in New York, and they're able to create 3D CT images for us. So those are the straightforward images. You can see multiple rib fractures. The ones on the right, the healing calluses are larger, and it was believed they were earlier. They're showing healing that is more advanced than the left side. And then I drew the lines just to get a sense of how the fractures match up and to think about, well, how many impacts were necessary? Because there are, let me see, 9 left side ribs are fractured and multiple right side. But there are different stages of healing, and this is just not possible to have occurred accidentally. In addition, the dog had his right canine tooth pushed up into his nasal cavity. So again, head trauma associated with that. And head trauma is common in abuse cases. In children, they understand motor developmental milestones very well. Less understood in animals. This is from the Monroe and Monroe book. By 6 or 7 weeks of age, kittens are able to turn over in midair and land on their feet. They do not land on the top of their heads. Explanation of falls to explain severe head injuries, including skull fractures, which are commonly encountered in non-accidental injury cases in kittens, are unlikely to be accurate. So we did a short preliminary study for the first 3 years with the NYPD program because the caseload has increased, so we're seeing a lot more of everything. And we looked at deceased dogs less than 15 pounds and skull fractures. And the question asked, you know, we always ask this question, how does this happen? You know, I don't know what I would do to create the injuries that I see in these animals. But because we're getting the police reports now, in the 7 dogs with skull fractures, 4 of the events were witnessed. And all 4 events, the animal was thrown. You know, it wouldn't occur to me that this is how they're being injured. In 3 of the cases, they were thrown to the ground, and 1, a dog was thrown against the wall. There were 3 events that were not witnessed, but there were skull fractures. In the cats, there were 2 of the 3 cats with skull fractures it was witnessed. 1 was thrown, and 1 fell from a height. So out of the 10 animals with skull fractures that we saw, there were only 6 event witnesses. In 5 of the 6, the animals were thrown. So think of that. That's a possible way that these animals are being injured. And I'll show you a couple of cases and the types of injuries in addition to the skull fractures that you might see. So you're probably familiar with this, and I've talked about it a little bit, the link between animal cruelty and human interpersonal violence with many possible victims. The abusers really don't care about the animals. Not necessarily looking to hurt the animal. They're looking to impact the person that they're attempting to control. So they're showing that person terror, you know, and they're threatening the pets or they're actually hurting the pets. And it's known that the pets are a barrier for the victims because they're concerned about the pet's welfare if they do leave. In domestic violence cases, not all of the abuse is physical. So the Ahimsa House is an organization in Georgia that's looking at the problem of the link animal cruelty with domestic violence. And in this study, there were 533 participants. 28% said there were multiple types of abuse. In terms of the actual percentages, 43% physically abused, but 57% reported abuse that was not physical, depriving animals of food and water, preventing access to veterinary care, leaving outside in extreme temperatures, giving alcohol or illegal drugs, or sexual abuse. So that link does not only apply to animals where you're going to identify or law enforcement has a case where there is actually physical harm to the animal. In New York City, between 2014 and 16, this is the first 3 years of our partnership with NYPD, there were 65 animal cruelty and domestic violence cases where both existed. This is the disposition of the case. 83% resulted in arrests. This is looking at the different boroughs of New York City, the 5 boroughs. This is the population percentage for each borough. So Manhattan, 19%, New York City's population, the Bronx, 17, Brooklyn, 31, Queens, 27, and Staten Island is the smallest borough with 6% of the population. And now this is looking at the total animal cruelty cases and the those 65 domestic violence cases. So total animal cruelty is the solid colored bar, and in Manhattan it's the exact same as the percentage of the population. But look at the Bronx. 31% of the city's animal cruelty cases with only 17% of the population. And the domestic violence cases are sort of a similar percentage, 28%. So more than 1/4 of the city's domestic violence cases. Brooklyn and Queens are underrepresented, and then Staten Island is also overrepresented. 5% or 6% of the population, 8% of animal cruelty cases, but 11% of domestic violence cases. So this is the kind of information we're starting to collect. It will allow us to hopefully look at where the problems are and address that by using resources. The relationship between the victim and defendant in the cases where there were arrests. In 37 of the cases where there were arrests, 68% were intimate partner, and then non-intimate partners. So it could be that it was a mother and son, or some siblings, or something like that. So, but the majority, more than 2/3, were intimate partner relationships. And then in terms of the intimate partner, boyfriends represented 57% of those, spouses 22%. We weren't sure of the exact relationship of the couple in 16%. And then fiance and ex-boyfriend only were 1 each, or representing 3%. This is how the animals presented to us. In the 65 cases, there were 78 animals. There were 53 that were alive, 25 deceased. So 1/3 of the animals were deceased in these 65 cases. Looking at cats and dogs separately. In cats, 11 were deceased, 10 were alive. So if you're a cat in that household where there's domestic violence, you have a 50% chance of being killed. Dogs were different. 13 of the dogs were deceased, 43 were alive, so like 1 in 4. And there was 1 hamster. Thought it would be interesting, looking at the difference between cats and dogs, to look at the weights. In the case of dogs, the ones that were deceased, the average weight was a little over 7 pounds. The live weight was 26. So that probably explains why there were less deceased dogs than there were cats. Cats, it really didn't make that much of a difference. The age was interesting. 91% of the dogs were less than 5 years, and actually close to 50% were a year or less. So for young animals. In cats, the age span was from 5 months to 17 years. And in some of these cases, it may be that and the majority of them are women, already have the pets, so the age of the animal is the age of the animal when all of a sudden there is a violent individual that's brought into that household. This is a case in Queens. Individual was accused of killing his girlfriend's dog. That's her daughter. There was an 11-year-old girl her daughter was 11 at the time. She took a crime scene photo. Okay, this is her taking this photo again. Crime scene photos are very, very important in these cases. So Honey had a traumatic brain injury. That pool of blood is undisturbed. He threw the dog to the ground a single time and caused fatal brain injury and multiple skull fractures. Skin contusions, broken incisor tooth, gingival laceration, pulmonary contusions, liver lacerations, left pelvic fracture. That's from that single incident, and there are injuries basically from the head to the hind end of the dog. That's the necropsy, and it shows the shattered skull. The diagram on the right is just a diagram of a skull showing the placement. That dog hit the left side of the head, but the way the skull is and that it is spherical, and the way energy travels, the fractures were actually shifted off to the right side of the head. And in addition, the left pelvis was fractured. So all from that single event. Throwing the animal against the ground will do that. Here's a kitten that was thrown against a wall, I guess against the ground. Again, nasal bone and mandible fractures with a traumatic brain injury, lung injury, 3 rib fractures, liver lacerations, right femoral neck fracture. Very similar pattern to the dog, and both the event was similar, both animals thrown to the ground. This is an older abuse case. This dog was brought in deceased. There were 3 distinct areas of hemorrhage on the head that represent 3 separate blows to the head. The blow to the top of the head is consistent with the dog being kicked in the head. I don't know if I would say that anymore. This is a few years ago. Be that exact. This blow was forceful enough to remove the top layer of skin. There were hemorrhage in all the tissues of the head, skin, fat, muscle, and hemorrhage in the brain. There were rib fractures. There was massive subcutaneous hemorrhage. The dog's inguinal areas to the right in that picture, that's just the skin reflected. So cause of death, probably a combination of traumatic brain injury and blood loss. Significant about this case is that there were 2 recent fractures and then an older bony callus. So this dog was injured over a period of time. And then additional information as a result of histopathology was that there was scarring on the surface of the liver and the kidney that was read as being at least a week to form the injury as it was seen. And then hemosiderin, which would require metabolism of hemoglobin from hemorrhage, was also seen microscopically in the liver, kidney, and lung. So evidence both with the radiography and the rib fractures and then histopathology that this was the fatal acute event was not the first time the dog had been injured. 5 years after the case, the wife of the abuser called for a copy of the necropsy report. At that time, she told me she was the victim of domestic violence. She had stayed in the marriage for an additional 5 years and was divorcing her husband, who happened to be a physician. So, there's no predicting how these cases are going to present. So a couple of cases where there's sharp force trauma. When the dog was first brought in, because there is an open neck wound and we see a lot of embedded collars, that was the initial thought with this dog, but this doesn't look like an embedded collar, where there's usually a lot of scar tissue. And it's a relatively even wound, so it looks more like an incised wound. The two descriptions of wounds for sharp force trauma are incised wound. Every veterinarian knows what an incised wound looks like. You do surgery and create them, and then a stab wound. The incised wound is longer than it is deep, and the stab wound is deeper than it is long. So, initially, like I said, law enforcement thought this is probably an embedded collar. It was reported by a groomer who was grooming the dog and found this wound. But the take was that this is an incised wound. Law enforcement went back, interviewed the individual, and he confessed to using a box cutter on the dog. This is another dog that was witnessed to be stabbed. So multiple sharp force trauma wounds, and then radiography showed cuts in the zygomatic bone associated with that head wound, and there was a notch in the vertebral process there underneath where the stab wound was on the back. So fractures occur under lumps that you see on the body. There can be cuts in bone associated with stab wounds. Radiography should be done anytime you see external lesions. Mentioned shooting earlier. This is an older man is walking his Chihuahua, and then she falls over deceased. Reports this to the housing police. It's a 10-year-old spayed female. That's the entry wound. It was actually a pellet. We're able to show the path of the pellet inside the dog's body. All of that work I do in Adobe Photoshop Elements. Okay, label that. When you are presenting a radiograph to people that are non-medically trained, they won't understand what they're seeing unless you label it for them. So, rib numbers, and if there are fractures, you saw that other one of the puppy, the dachshund puppy. It's just putting text and arrows and helping them understand what you're seeing radiographically. So with the skin reflected, you can see subcutaneous hemorrhage at the entry wound. And that's actually, the arrow points to where the pellet came to rest inside the dog. And you can see hemorrhage associated with that. Sometimes I use diagrams to help law enforcement understand what happened with the animals. Picture of the pellet. And then you can see the amount, just a pellet, the amount of injury it caused with a hemothorax and a hemoabdomen. I want to talk a bit about dogfighting. Can't be complete, but there are certain things I've seen in cases that I think are valuable in terms of what to expect. Here are some resources. Again, you'll get the PDF. One is from the Michigan State University website on animal law. Animal law is an evolving field like veterinary forensic medicine. It's sort of like a parallel evolution. In the early 2000s, there weren't that many student chapters of the Animal Legal Defense Fund. Now there are hundreds. So people are now, attorneys are now also focusing on animal cruelty as a distinct area of law to become expert in. And then the dogfighting toolkit, which Dr. Lockwood was involved in creating, is available to you. You have to send for it. I don't think you can download it as a PDF, but they actually get it out to you pretty quickly, and it gives a great overview of all the different aspects and some of the information, if you're not familiar with dogfighting, about that whole process. So a way that in an urban environment like New York City, dogs tend to be warehoused in cages that are stacked on each other. They don't get out of those cages. They live in those cages 24 hours. In this particular case, this is at 127th Street in Manhattan. And the complaint was actually a noise complaint. There were some outdoor kennels with barking dogs. NYPD went by. Actually, the animals were kept pretty nicely. The owner was not there. There was a caretaker. And then they're about to leave. And the caretaker says, "Do you want to see the dogs in the basement?" And they're like, "Yeah." And there were 14 dogs clearly involved in dogfighting. So I want to show you one because this individual had been fighting dogs for 40 years and actually posted a video that at some point during the investigation was found on YouTube, of him talking about the genetics and how proud he was of the different bloodlines that he worked with. And then you could take the names that he described, Google them, and one after the other, they show up on dogfighting sites. So this is a female. She had a severe injury to that left front leg in a fight. He liked her because that didn't stop her from fighting. So he wanted to breed her. She cannot walk normally. He did not provide her with any medical care, so she was disabled for the rest of her life. But she was bred and producing puppies. So that shows you the extent of the injury. It was soft tissue injury. Again, that was not provided with any medical care. Very large, thick callus on that left carpus because she walked on it for years. He went to a veterinary hospital, a local veterinarian, and said that he had bred her 2.5 weeks previously. He was concerned because she had a skin mass on the left side of her neck that was increasing in size. His concern was he would lose her to cancer. Did not care about her health. He told the veterinarian she used to be a fighting dog. So here he is breeding a fighting dog. And he saved her from euthanasia, is how he described it. This is in the medical history. He also warned the veterinarian that the dog is aggressive against all other animals. So he's telling the veterinarian it's a fighting dog, it's aggressive towards all other animals, and that he just bred it. But nothing happened until we finally got the dog with the other 13 dogs. When you do a multiple dog case, it's very helpful to the prosecutor to summarize your findings. Again, each individual animal has to be examined. They can't bring a charge for a group of animals. It has to be individual animals, but it does help to summarize things because the prosecutor can use that in describing the case to the jury. So skin disease, 13 out of 14 dogs, fleas, 9 out of 14, overgrown claws, sometimes that indicates a sedentary lifestyle, only 1 out of 14. Relatively severe dental disease in 8 out of 14. Scars from clearly what were dog bite injuries in 4 out of 14. And then we test every pit bull that comes through for the Babesia gibsoni, red blood cell parasite that's endemic in the pit bull population in this country. And the number that were positive was 3 out of 14. That's 21%. That's a high percentage. We had the opportunity to, because we started doing the testing in 2007, look at 187 pit bulls not known involved with dogfighting that came through. Most were neglect cases from 2007 to 2012, and the infection rate was 4% in that group. And time after time after time, we see the Babesia gibsoni infection rate much higher than that. 16%, 21%, sometimes actually 100%. One case in Brooklyn where there were 7 dogs, but 2 clearly had never fought, did not test positive, but all 5 scarred dogs tested positive for the parasite. It's additional information and it's cumulative in terms of everything we see. intestinal parasites, and then just 5 of the 13 dogs had significant mammary gland development consistent with pregnancy, obviously a breeding operation. So another way to summarize is we use little thumb scale type photographs and just a description of each dog's medical problems. So the one at the top is Choir. You can see her walking on that left carpus. And that's also helpful. And in this particular case, there were 14 dogs, and the prosecutor blew this up to have these big posters, you know, during the trial. And the detective said to me, I think I'm like in an organized crime trial. He said, that's what this looks like to me. But it's really powerful evidence in court. We always this is a different case. We always diagram scar pattern. You can see this is a fighting case from 2012 in the Bronx. It was actually the only dog fighting case in that. Well, there was one other. Really, that was the only dog fighting case I had seen in New York before NYPD, and now we're seeing cases every other month. They're doing a remarkable job investigating dog fighting. But the diagram is very useful because it helps show that pattern, and that dog had to have been bitten hundreds of times to have that scar pattern. And you know how much it hurts to have a dog bite, so you can describe that in your statement. And here's before and after for a dog that was in a dog fight. This wasn't organized dog fighting, but frequently you'll see an animal not right after the fight, but like this is the same dog. Okay, so that's how it looks a period of weeks after it gets medical care. And it's hard with a photograph, easier, you know, looking at the dog in person, but it's up to the veterinarian to describe in court that that's what the dog will look like after the actual fight. So when you see it and you have photographs of the dog months or longer after the fight, it's not going to look severely injured. But if you can identify the scarring, you can describe how severe it is to for a dog to have gone through that. So this is the 127th Street case. This guy had fought dogs for 40 years. You can go on YouTube, and his name is Vincent Cooper. These cases make me more mad than any cases I see. I don't know why. But I really developed a real dislike for this guy, especially seeing that video where he tried to present that, you know, he had some idea about genetics in dogs. They indicted him, this is the grand jury, on everything. 14 counts of misdemeanor animal cruelty. So animal cruelty for every dog. One count of dog fighting, and for Choir, a count of felony animal cruelty. Her injuries were so severe, and she suffered so much living like that he was indicted for aggravated animal cruelty on that case. So just the last case of the day. This was a dogfighting raid in February of 2010 with the ASPCA Field Investigation Response Team that goes to different places in the eastern United States to assist with large-scale cases. Dogs tethered outside with heavy chains, shivering in the freezing cold. All were emaciated and showed signs of severe neglect, including broken bones, open wounds, and infections. And there were also bodies of 27 dogs found in various states of decomposition. So this is a rural dogfighting situation where they live their lives on the end of a chain. This was Georgia. It was cold in the 30s. That 50-gallon drum, that's her shelter. And there was no water that we saw in any of the bowls. And the thing that shocked me about this case is, you know, look how underweight she is. And this is a breeding operation, and I would have thought that they would take good care of these animals. They're breeding them, they're trying to make money, they don't care about the animals. You know, it doesn't matter whether it's a breeding operation, certainly one where the animals are fighting. You could see how Choir was treated by this other guy. There's no concern for these animals, the welfare of these animals. So that's where she lived, in the freezing cold, with no body fat for insulation. Here's another dog at the same location. Another dog with severe leg injury, similar to Choir in the New York City case. So severe neglect in these animals. This was another breeding operation. There were these 55-gallon drums scattered throughout the woods, and there were no animals. When they died, they just left the drums there and they buried the animal at that location. So that's where the 27 dogs' bodies were found when the investigation was done. And then the ASPCA sets up a temporary shelter once the animals are taken from that location. So 2 individuals, the caretaker and the owner, of the 26 live dogs, misdemeanor animal cruelty in all counts, 10 years total to serve 5 years in state prison, 5 years probation, a $1,500 fine. You know what probation is? Probation is when an individual that is on probation cannot be arrested for any other reason. And it's difficult for these people because they're criminals. So they're always doing bad things. And then they go back to jail immediately when they are on probation and they commit another crime. The caretaker also found guilty of 26 counts of misdemeanor animal cruelty, 10 years total. 1 year in county jail, 9 years probation, possession of a firearm by a convicted felon, and that's an additional charge, 1 year in county jail and 5 years probation. So that's what I have for you today.